Did you know that diabetes is a growing problem in Malaysia? Statistics show that compared to 2006, where only 8.6% of Malaysian adults had diabetes, this has skyrocketed to 16.6% in 2014, with an alarming 3.6 million adults being affected. We are the #1 country in ASEAN and 6th in the Western Pacific region for having the highest number of diabetics. So, Dr. Haider, how often do you get diabetic patients in the clinic?
So yes, I receive many patients with diabetic condition. Most of them are controlled, but as I told you, there are some patients which I was the first one to tell them you need to check for your diabetic due to their periodontal condition or gum problems.
So what are the common reasons for their visit to the dentist?
Usually, for me, because I am gum specialist, if we say in the academic term or clinical term periodontist, they come for gum problem, either by themselves after they know about there is a specialty like this, or maybe referred by general dentist. So most of them they come with gum problem, ranging from mobility of the teeth, residing of the gum tissue, bleeding from their gum, to more aesthetic concern, for example, some sort of gum enlargement or gum discrepancy, and they want to correct it, especially female patients.
And what would their main concerns be with regards to diabetes and oral health?
Well, usually they want to know why there is a relation, and we need to explain that for them. We need to tell them first, once you control your diabetic, this can remarkably affect the health of your gum and supporting tissue. And we need also to inform them that now we have evidence-based research which also say that controlling the inflammatory condition or the inflammation of your gum tissue will help you in controlling your glucose level.
Can you briefly explain the correlation between diabetes and periodontal disease?
Yes, let me put it in simple terms. Diabetic is a syndrome. That means it's not a disease affecting one organ, but it's a condition related to certain reason that can affect many organs in the body. Now, main reason of the effect will be inflammatory process. When it's affect the kidney, affect the heart, affect the gum, it's inflammatory process. Periodontal disease also is inflammatory process. And this inflammatory process of periodontal disease initiated by bacteria, which are present in the dental plaque on your teeth near the gum. So, the simple way that when the inflammatory process of gum diseases happen, it can exaggerate and accelerate the inflammatory process of the diabetic tissue. And that will lead to more effect and more distraction to the tissue. So from that point, it's the exaggerating response of two inflammatory processes. They share together.
Okay, so how does the periodontal disease affect the diabetic patients, whether it's physically or socially?
The response will be exaggerated more than normal patient. That's mean the gum will be inflamed more. You can find pus around the teeth, multiple pusses around the teeth. We can find something we call it pocket, which is the space between the gum and the tooth, and then it will end maybe to loosening or shaky of the teeth. That's why we believe that by controlling the gum inflammatory process or your gum diseases, it can really affect also and help you in controlling the quality of your mouth.
What is gum disease? Gum disease involves the bones, gums, and other areas of support for teeth. Having diabetes mellitus increases your risk of gum disease by threefold. There are two types of gum disease, gingivitis and periodontitis. For gum disease, you might notice these changes in your mouth: swollen, red and tender gums that might bleed upon brushing indicate gingivitis. There might also be bad breath or bad taste in mouth. Gingivitis can be treated and returned to normal, but if left untreated, it may lead to receding gums and bone resorption. In this stage, it is called periodontitis, which is more destructive and not reversible. Eventually, your teeth will start to appear longer and might end up shaking. Do visit your dentist if you notice the above signs and symptoms immediately.
So how does diabetes make gum disease worse? First, the high sugar level in your mouth fluid enables bacteria to survive. Then, your blood vessel thickens, causing a slower flow of nutrients and removal of harmful waste. This can weaken the resistance to infection. Normal immune function is affected, leading to impaired wound healing. Not only that, there will be less saliva in your mouth, leading to dry mouth.
Great news! It only takes 6 steps to help keep those inflamed gums away. Step 1. Maintain good oral hygiene by brushing every day, 2 times a day, in the morning and before going to bed for at least 2 minutes. Use fluoridated toothpaste and a soft toothbrush. Position the toothbrush at a 45-degree angle to the gum line. Gently brush the outside, inside, and chewing surface of each tooth using short back and forth strokes. Don't forget to gently brush your tongue to remove bacteria and to freshen your breath. Remember to change your toothbrush every 3 months or sooner if the toothbrush looks worn or the bristles spread out. Step 2. Use a floss to clean your teeth every day. Flossing your teeth at least once a day helps to clean the tooth surfaces between adjacent teeth that our brushes cannot reach. It's as simple as sliding the floss up and down and then curve it around the base of each tooth under the gums. Remember to use clean sections of floss as you move from one tooth to another. Step 3. Swish with mouthwash. Use mouthwash that contain either fluoride to prevent tooth decay or chlorhexidine to kill bacteria in your mouth. Gargle for 30 seconds. And then spit it out. Step 4. Go for regular dental checkups. Ensure to tell your dentist that you have diabetes and follow your dentist's advice. Step 5. Keep your blood glucose level controlled. Ensure to eat healthy meals and follow the meal plan that your doctor advised. This is a very important step to not only ensure you have good oral health but also overall well-being. Last but not least, step 6. Stop smoking. Smoking can increase the risk and severity of gum problems.